BJP versus Congress Health Department in Karnataka is ailing. Health is very, very important. You and I, we've all gone through what it meant during COVID. And therefore, this story. A full-blown political showdown is happening in Karnataka. The BJP and Congress have locked horns over the state's health system, with the opposition alleging a complete breakdown and the government hitting back real hard. The BJP has launched a scathing attack on what it calls an ailing health department. Leader of opposition R. Ashoka alleged shortages of medicines, staff vacancies and internal chaos within the system. According to the BJP, patients are apparently being forced to turn to expensive private hospitals, with even basic facilities missing in government setups. The party also flagged numbers, claiming Karnataka spends just 4.9% on health, compared to 14.5% in Delhi and 8.4% in Rajasthan. And my God, that's a huge, huge gap. We'll ask the experts. Adding to the concerns, out of over 7,000 sanctioned doctors posts, barely 4,900 have been filled, and nearly 40% nursing posts still remain vacant. The BJP also cited medicine shortages, alleging district hospitals have only a fraction of essential drugs available.
94 ಕೇರಿಸಿ ಇವತ್ತು ನೀವು ನೋಡಿದ್ರೆ ಪ್ರತಿಯೊಂದು PH ನಲ್ಲಿ ಕನಿಷ್ಠ 234 ಔಷಧಿಗಳು ಇರಬೇಕು. 30 ರಿಂದ 50 ಔಷಧಿನೂ ಇರಲ್ಲ. ನಮ್ಮ ಧೀರಜ್ ಮುನ್ರಾಜ್ ಅವರು ಹೇಳ್ತಿದ್ರು 10 ಇರಲ್ಲ ಸರ್ ಅಂತ ಹೇಳಿದ್ರು. ನಾನು 30 ರಿಂದ 50 ಹೇಳ್ತಾ ಇದ್ದೀನಿ PH ಗಳಲ್ಲಿ. ಹಾಗೆ CHC ಗಳಲ್ಲಿ 393 ಔಷಧಿಗಳು ಇರಬೇಕು. 40 ರಿಂದ 60 ಔಷಧಿಗಳು ಇರ್ತದೆ. ತಾಲೂಕು ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ 478 ಔಷಧಿಗಳು ಇರಬೇಕು ಕನಿಷ್ಠ. ಅದೇನು ನಾನು ಹೇಳ್ತಿರೋದು ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸ್, ಡಿಸೈರಬಲ್ ಡ್ರಗ್ಸ್ ಅಲ್ಲ. ಡಿಸೈರಬಲ್ ಅಂಡ್ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ 543 ಇರಬೇಕು. 551 ಡಿಸೈರಬಲ್ ಇರಬೇಕು. ಅದು ಸೇರಿಸಿದ್ರೆ 1094. ಆದ್ರೆ ಇಲ್ಲಿ ನಾನು ಹೇಳ್ತಿರೋದು ಬರೀ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಮಾತ್ರ ಹೇಳ್ತಾ ಇರೋದು. ಡಿಸೈರಬಲ್ ಡ್ರಗ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇಲ್ಲ ನಾನು. ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ 543 ಔಷಧಿಗಳು ಇರೋ ಸ್ಥಳದಲ್ಲಿ ಇರಬೇಕಾಗಿರುವಂತದ್ರಲ್ಲಿ ಕೇವಲ ಬರೀ 150. ಯಾವ ರೀತಿ ಆರೋಗ್ಯ ವ್ಯವಸ್ಥೆಗಳು ಇವತ್ತು ಔಷಧಿಗಳು ನಾವು ಹೇಳ್ತಿರೋದು ನಾನ್ ಬರೀ ಹೇಳಿರಲ್ಲ, ಎಲ್ಲಾ ಪತ್ರಿಕೆಯಲ್ಲೂ ಔಷಧಿ ಭಾಗ್ಯವಿಲ್ಲದ ಸರ್ಕಾರಿ ಆಸ್ಪತ್ರೆಗಳು ಅಂತ ಪತ್ರಿಕೆಗಳಲ್ಲಿ ಬಹಳ ಸ್ಪಷ್ಟವಾಗಿ ಅನುಮೋದನೆ ನೀಡಿದರು. 890 ಔಷಧಿ ಖರೀದಿಗೆ ಹಿಂದೇಟು. ನಾನು ಹೇಳೋದ್ರ ಜೊತೆಗೆ ಪತ್ರಿಕೆಗಳಲ್ಲೂ ಬಂದಿರೋದು 496 ಔಷಧಿಗಳ ಖರೀದಿಗೆ ಟೆಂಡರ್ ಪ್ರಕ್ರಿಯೆ ಪ್ರಾರಂಭ. ಸರ್ಕಾರಿ ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಔಷಧವಿಲ್ಲ. ಔಷಧ ಕೊರತೆ ಜಿಲ್ಲೆಗಳಲ್ಲಿಯೂ ಬಿಸಿ. ಈ ರೀತಿ ಪತ್ರಿಕೆಗಳಲ್ಲೂ ಇದಕ್ಕೆ ಬಹಳ ಸ್ಪಷ್ಟವಾಗಿ ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿರುವಂತ ವಿಚಾರವಾಗಿದೆ. ಆದರೆ ಸಚಿವರು ಮಾತ್ರ ಯಾವಾಗಲೂ ಉತ್ತರ ಕೊಡೋದು ಔಷಧಿ ಇದೆ, ಎಲ್ಲ ಔಷಧಿಗಳನ್ನ ಇಟ್ಟಿದ್ದೀವಿ, ಎಲ್ಲ ಔಷಧಿಗಳು ಲಭ್ಯವಿದೆ, ನಾವೆಲ್ಲ ಕೊಂಡ್ಕೊಂಡಿದ್ದೀವಿ ಅಂತ.
But then the Congress government rejected these charges. Health Minister Dinesh Gundu Rao dismissed allegations. He said procurement systems have been reformed and nearly 890 medicines are now being sourced with better monitoring. He said so far as staffing is concerned, he says rationalization is underway. Doctors are redeployed based on workload to ensure round-the-clock services. Look, what has happened is that when Gundu Rao says from community health centers, they've been sent to primary health centers. The thing is that community health centers are saying, where are the doctors, the gynecologists and other doctors? What do we? So what Gundu Rao is saying that we keep redeploying so that it's adjusted. It's very clear that there is a shortage of doctors and the health system seems to be under stress. But we need solutions, not real politics. Sat Prakash, Vice Chairperson and Spokesperson for the KPCC is here, and Ashok Gowda, Spokesperson for the BJP. Thank you so much, gentlemen, for joining us. Satyaji, first you, because this has been going on. I mean, even earlier the minister, Gundu Rao, he had said that, Dinesh Gundu Rao, I beg your pardon, had said that I don't want to actually apply ESMA on this. The doctors should not strike. They are saying, no, we don't get pay on time. We are very short of staff. Now this CHCs, which is the community health centers, this is, he says, Dinesh Gundu Rao says this is actually, these transfers are based on counselling. But the point of the matter is that there is a shortage there, Satyaji. And also, additionally, there is a shortage of medicines. Please, your opening comments, sir.
See, as you know, the CHCs, a lot of people don't want to go to CHCs. Everyone wants to stay in the district headquarters, okay, in those bigger hospitals. Then no one wants to go to the small hospitals where they have to do all the work. That's point number one. The second point is, they are doing a lot of recruitments already. The recruitments have started. Okay. As you know, 58,000 new recruitments will happen this year alone, out of which in the health department also the paramedical staff, and even at the doctor level also, yesterday I've seen, in ESI, they have called for nearly 42 doctors. With respect to some specializations, there is depth of doctors. Still, our government was the first to go to appoint these doctors on, by giving them higher pay. That also we have tried. See, we also need to understand that, as far as medicines are concerned, we have a process in place wherein, we have a warehouse, Karnataka State Medical Supplies Corporation Limited. On a nutshell, in a nutshell, there should be around, 534 medicines. If some medicines are not there, are not being supplied by, KSMC, KSM, SCL, still the concerned directors or the medical superintendents of those hospitals are given ad hoc funds where they can source from their,
Sir,
their
but
CBO.
your own minister, Mr. B.R. Patil, he also raised his voice. He contradicted Mr. Dinesh Gundurao and said there were no doctors in the CHC in his Ailing constituency and shortage of medicines. This is not the opposition saying it. He said the officers must have misinformed you. This is what he is saying. There is a shortage. It is not the opposition alone, sir. I am saying the government has to take cognizance of the entire matter, because this, you are right, not everyone has to go to community health centers, but some have to go. Look at this report. There is, because of the transfer policy, see, this is CHCs have become virtually defunct. They are all transferred. Even those who give anesthesia. Mr. Ashok Gowda, come in here.
Hey, Sudhaji, the healthcare has become paralyzed by 5 C's. That is collapse, corruption, and systemization, has completely taken, has gone down. And there are other issues. Let me explain one by one. See, I've read the files, how the corruption has happened. That's in the purchase of the materials, and as well as in the equipments, and as well as the pharmacy. See, in pharmacy, they have supplied for the medicines which are given to be for the horses, they have supplied to human beings. And in the house, when our opposition leader, Chalwadi Narayan Swamiji, upper house, he questioned them, and Dinesh Gundurao conveniently said, we have blacklisted them and we are going to correct it. And that is the measure. He did not say what is the punishment. Only blacklisting is a punishment. That is the only punishment what he said. That is point number one. Point number two. The sanitary pads which are supposed to be given by the health department now has been transferred to the women and child welfare department, and they are not transforming. They are not giving sanitary pads at all to the girl children in the schools. That is point number two. Point number three. Not just in 1 or 2 medicines. The tablets, calcium tablets, which are supposed to be 8 paisa, which was bought by the government of Orissa, Karnataka government has paid 24 paisa for the calcium tablets. So when this kind of a corruption is happening, our government, the Karnataka state government, is happily enjoying the comments and not doing anything. This is part of the corruption. Collapse. How the collapse has happened? Whether it is PHU, whether it is CHU, whether it is Taluka hospitals, you go anywhere. It's not just a staff. D group employees are not getting paid. D group employees, and it's forget about the nurses or forget about the doctors. And even when the doctors are asking the question, they are not at all least bothered. The government is least bothered. Now come to the main agenda. Now, as you said, the budget of the Karnataka government allocated for the health department for 25-26 and 26 and 27, it has been reduced by 10%.
Yeah, which is,
and our Satya Prakash ji conveniently says, we are going to improve. We are going to improve. How are you going to improve when the budget is cut by 10%?
Yeah, that's what I want to ask you, Satya. The budget, look at it, the Delhi budget. And
no, I have only one more point. Central government sponsored schemes. For example, in the maternity, there are 15 schemes. 15 schemes. Wherein,
Quickly,
no. I'll 15 schemes wherein central government is sponsoring the lot of other things, nutrition and other things. Believe me or not, 11 schemes the Karnataka state government has not availed the benefit at all.
Right, okay. Satya, your chance now. A lot of allegations, but I want to ask you one thing. First thing. So apparently, neonatal care, when the baby is born, that's neonatal, of course, you know what it is. But for the benefit of those who may not know, from community health centers, to Taluka hospital, the shifting happens, transfers happen, because if there are less deliveries there. What is this? What is this? This is not potato or tomato, that if you have less, I will give you 1 kilo more. There has to be a better policy there, no, Satya? Your turn. to answer all the allegations made by your friend Ashok?
I will not speak what about it. Okay? If there are corruption charges, the MLAs of the BJP, the assembly is in session, they should go with the proof. No water bottle. We don't want lessons from 40% Sarkar, whom Karnataka government rejected. And they gave a overwhelming majority.
I think, Satya, I beg your pardon. With due respect to you, you are resorting to now whataboutery. 40% Sarkara, that is ancient history, I say.
The problem is, you will not even allow me 1 minute also to speak while you give a free run to you. Listen to me fully. If I am still doing whataboutery, then you come to one conclusion. I'm saying I don't want lessons from a party which is
Okay,
which
go
itself
ahead.
was involved in 40% corruption. Okay, and if there are any corruption charges, the assembly is in progress. If their ex health minister, Mr. Ashok Narayan, should come with adequate proof. The leader of opposition, Mr. Ashoka, should ask Mr. Dinesh Gundrao in the floor of the
He
assembly
did.
with valid proof.
He did.
So whatever is not done, I can tell what my government has done. My government, Mr. Dinesh Gundrao, the health minister, has said in the floor of the house that we have allocated 868 crore rupees for buying medicines through KSMSCL. And still there are ad hoc budgets with all the directors. If still the directors feel there are few medicines which are not there, they can always buy it. I will not say all the hospitals in this state there is no short supply. I am not a hypocrite. But how many hospitals we might have short supply? We might have short supply in 5 or 10%. Our government will definitely look into it. If our own MLA from Anand has said in a particular CSC there is a problem of staff,
Thank
we
you,
will rectify
gentlemen.
it.
Thank
If around 5 or 10% of CSCs there are a problem, we will rectify it is all I
You're
can say.
giving us
I will
hope.
not.
You are giving us hope, Satya Prakash, and I hope that it is solved because Ashok also wants the same thing.